Welcome back, everybody. You're listening to Cut the Shit, a podcast series that aims to take a closer look at the impact of the IT industry, both the good and the bad. Cut the Shit is brought to you by Plow Networks, a managed IT services company based just outside Nashville, Tennessee. I'm Bryan Link, COO here at Plow, and I'll be your host for this series. I'll ask questions, and with the help of our guests, try to dig deep on some of the key challenges we all face dealing with IT. So with that, let's cut the shit and get started. On today's episode, it's my pleasure to have Scott Breece on as our guest again. Scott is the first official repeat guest on Cut the Shit, so he can put that on his resume now because I know that's going to be a big plus for him. If you recall from previous episodes when we had Scott on, Scott is currently Chief Information Security Officer at Cerner / Oracle Health. Prior to that, he had a long career at CHS and prior to that, HCA. So he spent a lot of time in the healthcare IT area and then specifically getting into the security side of that particular business. Today, we talk kind of as a follow-up to our last conversation. We spent some time talking about the nature of IT as an investment, how to think about that as a concept, how to frame up the expenditures of monies on IT services, and how to help businesses understand those investments, to think of them as such, and then to measure the value of those investments over time. So Scott's had a lot of experience with that in his career, and I felt like that would be an interesting topic, again, as a follow-up to the conversation we'd had before. So I hope you enjoyed this conversation with Scott Breece. Scott Breece, welcome back to Cut the Shit, Part 2.
Thanks, Bryan. Thanks for having me.
Glad to have you. Thanks for, I guess, either you're a glutton for punishment or you actually like this sort of thing. And whichever's the answer, it's fine for you just to keep it to yourself. But we're glad you're making time for us. So.
Well, I'll keep doing it as long as I can or until somebody tells me you look like a fool on there. So, yeah.
Well, fortunately, we live in a part of the country where people are sometimes too nice to tell you the truth. And that can be bad sometimes. Maybe in this case, it's a good thing. I don't know. Because, I keep thinking someone's going to tell me that too, and they haven't. So I keep pushing forward. So there's that.
I think the key words that you got to look for is bless your heart.
Then
you know.
That's right. Good point. All right. Well, as I mentioned, even though this is your second time on the podcast, and again, thanks for doing that. There definitely are going to be listeners who haven't heard the first one. So, with that, they definitely should listen to it, but they probably haven't. So give us, kind of like last time, give us a quick thumbnail sketch of your background and kind of how you got into technology.
Yeah, sure. So currently I am the Chief Information Security Officer for Oracle Health, which was the Cerner acquisition. Prior to that, Community Health Systems, I was the CISO there for 14 years. And then prior to that, I was in HCA. So I've spent, I'm going to date myself again, 23 years in healthcare my entire career. So that's how I kind of got into technology.
And at HCA, if that was your beginning, was it IT from the beginning, or did you move into IT?
Oh, no. So I came out of college to a Thomson technology company, and that's where I started technology.
Gotcha.
I was a database. I built databases for patient forecasting and planning.
Got it. So that was the entree to healthcare. I got you. Okay, perfect. All right. Well, again, since there's a group of folks out there who did not hear our first conversation, a quick recap. We talked about the IT budgeting process, which, sounds super sexy, I'm sure. So people right now are stopping this one to go listen to that one. But I would encourage them to listen to it because it's probably not what you think. Because the whole goal of that was to talk about sort of this idea of, well, how do you do IT budgeting? What does that mean? How do you do it, again, in the context of helping the business understand what it is you're asking for, right? Why are you asking for something? This pot of money you need, what's it for? What's it going to do for us? And translating that into, I'll use language, but sort of an understanding, a business understanding, so that the C-level folks or the decision-making people who are most likely not IT people can understand what you're asking for and why it would matter. And so today we wanted to pick up a bit on that concept, something from that conversation that struck me, and it kind of bounced around in my head, and that was what I was, I reached back out to you about. And that's this idea of IT investments. That's something you used. You used that expression quite a bit in that first conversation. And I liked it, but I kind of wanted to push you a little bit on that. Because I'm sure there are a lot of business people who, when they think of IT, they just think of it as an expense, right? It's money they got to spend on something like, anything else that's consumable. You got to have it, but it's not actually doing anything, quote unquote, in terms of generating a return. And so why don't we start with talk a little bit, explain that concept, this idea of IT investments, and what do you mean when you use that expression?
Yeah, IT investments. An investment to me can be a service or a solution, right? But I also view it as if I make this investment, because everything costs, right? It's either, I think perpetual's almost gone by the wayside from a licensing standpoint, buy it, pay maintenance on it, to more subscription based. And so if I'm going to go and ask for these dollars, I want to understand what investment I need to make in a technology or a service offering. And then I have to show what what my intentions are and what that means for the business. So for some examples, I generally take a look at, all right, do we have an enormous amount of support tickets? Are we adding bodies because we're doing things manually? Is that something that we could build a better process or make an investment in a platform that could then lead to 6 different areas of the business? And then if there's opportunities like in healthcare, and one of the examples I'll talk about here in a minute, Bryan, is I think identity and access management is a core to a lot of businesses. It could be small, medium, and large, right? But in healthcare, that's important because the sooner that the clinician can get into the system, provide the patient care, the more patients they can see, right? And it's critical to them not to have to take 10 steps or remember 10 passwords to get into these systems. That's just one example, and I can elaborate a lot more on that as well. Knowing your assets, a life cycle process to that, I think is critical to any business as well. Because if you're running tight on margins and your revenue stream is pretty consistent, but you have to still make investments in the business to grow it. You definitely want to know what you have, where it's at, and identify, going back to those opportunities of manual processes or a new line of business that you can go and tackle. So I think when I say use the term investment, I think about it from a business perspective. A lot of my peers are probably more cyber focused, and I think that is an important investment, especially nowadays, how the number of attack surfaces have grown, the attacks have evolved themselves and matured, and they're becoming more sophisticated.
Right.
But they can have a serious negative impact on a business. I've seen that quite a bit here recently with some of our customers.
Yeah, and that's an interesting, maybe something to expound on a little bit, at least, and it's something in my head. The idea of an investment, we generally think of it as, you buy a stock at 20 and it goes to 40, right? And it's doubled in price, right? That's you spend money now for it to be worth more later, right? That's sort of the baseline or sort of the, most basic definition of investment. But you just described the idea of spending money on cyber to prevent losses, right? And so talk a little bit about that sort of, I call it maybe, that's not a negative investment, but I don't know what you'd call it. It's a risk management investment, but talk to us a little bit about that concept and those two sort of differing, investments in sort of positive investment growth or positive returns to the business versus protection from downside losses, something like that, I guess, maybe.
Yeah, I view that as a required investment. Especially if you are using software as a service to run your business, or if you have multiple office locations, you've got connectivity. Most email is in the cloud now, right? So I call that a required investment because, again, going back to nation state attackers becoming more sophisticated, we're more digital, mobile, on the go. You have to have the appropriate tools in place to identify, mitigate, and sometimes even eradicate and remediate if they get in. And like ransomware, it'll stop your business. Like you won't be able to work.
Right.
We see we've got some customers that have come up with DR plans, like in the healthcare space. I know I fall to that. That's mostly my career, but
that's fine.
We've seen some smaller hospitals get hit, and what they do is they have some laptops that they keep offline with cellular cards in them, and then that way they can reach back into the hospital systems that are remote hosted at like Cerner, for example. And so that's their DR plan while they bring in a third party and do the remediation. Now, there's a post investment on that as well, right? Because now you're going to have to improve your security posture because you didn't make all the necessary investments up front to detect and respond to those things. So yeah, I call that a required investment because it can cut the revenue stream off very fast.
Yeah, makes sense. I mean, obviously, healthcare is your primary domain, as you laid out in terms of your career and some of the examples. And I want to turn to some of those some examples of investments specifically. You mentioned one already, identity and access management. But before we get that, I got a couple of questions, and this is more as you kind of look backwards. Are there examples? Can you think of examples in your career where there was money spent on IT that wasn't thought of as an investment, but turned out to be so, where we thought we were just spending money on something and it actually turned out to be, it leveraged in a way that people didn't expect?
Yeah. So and that's kind of my experience at community health systems with identity and access management. They had made an investment in it. It failed twice to get implemented correctly. So imagine being a physician, and you've got your main EHR, you've got your lab, you got your cath lab, pharmacy, all these additional systems you have to log into. Well, of course, you're gonna have to remember all those passwords or get IT to set up one username and password across all those systems, which I did see that as well.
Sure.
And so, what does that do? That increases support tickets, that requires you to hire somebody at the service desk, man it 24/7 because hospital operations don't stop. And it becomes a very ineffective way to manage access across hospitals. And so on the third attempt, we took that identity and access management system. We did a big planning session from an architecture perspective. So we said, hey, here's our use cases. These are the systems that we know are the primary applications that the physicians use the most, because we did a survey across the hospitals to make sure that we could understand, what was priority in the way of the systems. Because if you're going to make an investment into the integration with identity and access management, you want to start with the ones that are used the most.
Sure.
Because then you get higher satisfaction levels very quickly as well, and that shows the physicians and clinicians that you're listening to them.
Right.
And so what we did from there was we built an architecture in our data center where we ran it across multiple racks, so that if we lost power or because we had A side, B side, we wouldn't lose the IAM system because they became so dependent upon it. So doing the appropriate planning, building the right architecture, building the right project plan to go and implement this and make it meaningful and useful and not waste money doing it in the process was some of our key thoughts as we approached it. And then the other thing is we said, well, if we provision these single username and password across multiple systems, they still have to go and type it in. And we were like, what about tap and go is what it was called at the time, or single sign-on.
Yep.
And so you used RFID badges, and they had readers at all the workstations. So once we layered in the actual core IAM platform, we laid single sign-on on top of it. And then we layered critical applications and external-facing ones with MFA. So there were multiple investments to be made, but ultimately, we reduced support tickets, I want to say, by 60% in our first year doing the integration, which means they needed less staff on the service desk to support these things. It was all centralized at a corporate function. And then we also set the tap and go, or the SSO, that when you walked in first thing in the morning, you had to remember one password. It would automatically populate your username. And then they would go throughout the day for 12 hours just tapping around. Right. And so they wouldn't have to enter anything else in. But at the end of that 12th hour, that first minute passed, you had to re-put that password in, just so that we make sure we put a little bit of trust behind using those badges that way. But and then from a single sign-on or MFA perspective, the investment we made there, certain solutions come with the ability to say, if you haven't updated your patches or you're on an unsupported operating system, we could block you from gaining access. So that was one layer of security. But then the other layer of security was, the MFA. And, we thought about it. We tested it with some physicians, and they didn't want to enter a 6-digit PIN. They didn't want to pull out their mobile devices in front of their patients, as some of the other feedback we got. So we told them to make investments in watches, because it pops up on the watch. You just hit approve, and then you're put right in. So that was an accelerator for them, and they loved it. They adopted it very quickly too. But ultimately, I think in the core EHR platform, by the time I left, we had 50 to 55 integrated applications across 129 hospitals. And we also, in the revenue side of the house, with the chief purchasing officer and the chief financial officer and them, we were able to integrate their systems at the hospitals and at the corporate office, so that they could have the same experience for a single username and password across all those systems. So not only did we deploy to the hospitals from a clinical care perspective, we were able to do integrations on the business office side of the house,
right,
to make their life a lot easier as well.
Which wasn't really part of the initial plan, I'm guessing.
No, it was not. But once they started seeing
once they saw it, how easy it was,
efficient, effective it was. But then in the core piece of this as well, I think there was probably 400 to 500 different roles-based workflows in there. So instead of centralizing the support at the corporate office as well, but we also introduced self-service, so you can go in and request roles-based access without having to wait for somebody to do your ticket or take a phone call. And then it has approvals associated with that. So we, as a publicly traded company, we had to make sure we had segregation of duty for SOX. So we had manager workflows built in that required approvals. And then every 30 minutes, from a security perspective, we would check the HR system. If you were termed, it would automatically disable your access. And some of the other little things that we saw benefit from was HR. As you move CEOs, COOs, and CFOs between the hospitals, they could go into the IAM system and do that transfer themselves without having to rely on us.
Go to IT, right?
Yes.
So you some more say kind of continue to push the self-service aspect, which takes load off IT and actually increases satisfaction, right? Because they can get the job done faster, right?
Yeah, absolutely. And the CFO and the COOs who I worked with the most while we were deploying this, and they loved the fact that anytime a clinical project was discussed by the chief medical officer or the chief medical information officer, the first thing they said was get it integrated with the identity and access management system. So we're plugging it in up front, and we can increase the user experience.
Yeah. That's interesting. What was the level of skepticism as you guys went for the third time as a charm effort?
We asked for 1.6 million. They gave us 600,000, and they said, go spend that and show me how it works. And then they gave us another 400,000, and we got through that. And then they started to see the benefits of it. And it was one of those things that they gave us chunks at a time.
Yep.
And so it enabled us not to boil the ocean. We were able to break down our program into consumable chunks. And over time, there's a committee of physicians that meet with the chief medical officer, and we became part of those conversations.
Very good. Well, that's definitely that's a good case study for success. So, not to be dark. Again, it's Friday and sunny here, so I certainly don't want to go into a dark place. But what were some examples of where that went the other direction, where there was, you were part of an effort where we requested, and let's not use the two failures on the front end. We've already talked about those a little bit, but where requested money, want to make an investment, and it just didn't work out. Like either we couldn't get it there, or we got done what we thought we wanted to get done, and it just isn't doing what we thought it was going to do. Yeah,
that's a good one. I've got probably 4 or 5 of those in my mind.
Yeah, unfortunately, I got a couple too. Wish I didn't.
We all have some, right?
Yeah.
Not to stay on that IAM portion, but when we first implemented multi-factor authentication because of a security incident. We went with the Microsoft Authenticator at the time, and because it was part of our enterprise agreement with Microsoft. So why not take advantage of that investment you've already made instead of
already there? It's included. It's already paid for in that sense. Yeah.
Yeah, and it wasn't as user friendly as it is today. So we had a high rate of failure with physicians being able to onboard to it. We also saw that our authentication rate was about mid to low 70s success rate. A lot of pushback from the physician base, especially the referring physicians who were just accessing the system, maybe once a month, twice a month.
Didn't use it enough to really get familiar with it. Right.
Right. Yeah. And we got a lot of negative feedback, especially through the chief medical officer and chief medical information officer. So it was one of those things that we thought we had implemented well. We even put training pamphlets together. So it was like a threefold. So you just open it up, step 1, step 2, step 3, simplified it as much as we can. And I don't know if it was the training by the field deployment team telling them to do the callback number as their authentication, or if it was the text mesh. I'm not 100% sure. I think there might have been some failure in the training process as well.
Right.
And ultimately it led to find something that gives us a better user experience. Right. And
this isn't working. Right. Yeah.
Right.
Basically. Yeah. Whether it actually works technologically is not the point. We have an adoption problem. Right. Yeah.
Absolutely. Yeah. Absolutely. Yeah. And I remember a time we made an investment in an intrusion prevention system that, yeah, you stick it in line, it'll block stuff and not the right stuff.
Well, or a lot of times they'll block everything, right? And then what happens is people are like, I can't do my job. Like I can't get anything. And then it's like you lose. I mean, it's a really delicate balance to try to, doing security is really hard, right? Because it's one of those things that, you can leave it wide open and it's great until it's not. And then someone says, well, why was this wide open? It's a bit of a gotcha situation for sure when it comes to that kind of stuff.
Yeah. And I even have one, Bryan, where we made an investment in a new type of firewall. We swapped out the old Cisco, what were those called?
ASAs.
ASAs, yeah. They're just access control list. And when we put the new firewall in, we were configuring the VLANs, and somebody had thought that they made a mistake and went to delete that VLAN out, and it was the wrong VLAN, and it shut the internet down for the entire company. So it wasn't that it was a wrong investment that was made. It was just a simple human error. Well,
and that gets to one of the points I was thinking about investments, this idea of investments. And we tend to think of investments tangibly, right? Which is what technology are we buying and deploying, or what, could be a physical, piece of hardware or software. It could be a service. But you sort of alluded to it in your authenticator rollout that didn't work out very well. But how important is implementation when it comes to thinking about, or at least impacting, what we might call ROI on an investment when we're dealing with IT?
Yeah, that's a great question. It's, a lot of times it goes back to that required versus, hey, I've got a business proposition that I think I can solve and make an investment in. And, I was thinking about that prior to this podcast when we had our conversation in preparation for it. I think a lot of times people go after those hard dollar items to include in their ROI, but they fail to capture those soft dollar items associated with labor. So what we used to do is we built a cost model when I was at Community Health, that if we were going to go out and make an investment, we, as part of our RFP process, we would go out to different business partners and talk about, hey, this is what we're looking at doing. What would you gain in the way of value from this? And would it reduce your headcount? Would it automate a manual process? Or is there a way that you could use another module that would just help our justification with it? And so Yeah, tracking your ROI is sometimes a bit of a challenge, but we try to take the approach, not only think about the hard dollar savings you could get by making an investment in something, but also looking at your soft dollar.
Yeah, makes sense. Makes sense. So you mentioned it earlier, talking about subscriptions, but and back to this idea of sort of hard dollars versus soft. But when you think about the world of IT and how it's changed in the past 10 years in particular, how do you think about the idea of making IT investments now, and how does that translate into this sort of current era of, subscription services, consumables, the ability to, we've moved away pretty significantly, at least from the capex need to buy servers and data centers and stuff like that. There's still plenty of capital investments to be made. I'm not saying that, but they definitely look different than they did 15 years ago for sure. How's that translated, and maybe how have you and or your kind of how you've seen it in healthcare? How has the investment discussion changed, or has it, or how do you guys thinking? How are you thinking about that now in this sort of new era?
Yeah, no, that's a great question. Yeah, so the conversations have changed from, to your point, it used to be capex, especially in healthcare. A lot of things were capex, and
Right.
as the world has changed, I remember, gosh, several years ago, probably 6, 8, 10 years ago, they were starting to talk about this subscription-based model. And people like Microsoft benefited from that because then you used Word online instead of through O365 instead of having a client on your desktop. So they were the ones that benefited from it. But capital was something that we looked at from a debt perspective. And then subscription was actually hitting the bottom line. So when we talk about that conversation between capex and OpEx, based on subscription-based pricing, I guess one is I'd recommend you understand your accounting principles for your organization, because some have long-term, short-term buckets for capex. Some are just managing the bottom line, and so yeah, those conversations get harder when you're talking about OpEx and the subscription-based impact on the.
Yeah, and I guess not to interrupt, but in terms of healthcare financing and sort of what the model looks like, has there been an adjustment? Has the business side of the house had to accommodate that? Because I don't know what's happened outside of IT, maybe a medical device world or other things. Maybe that sort of subscription, blank as a service. Maybe that's in other areas of the industry now as well. So just curious, because to your point, yeah, those capital expenses, if you're borrowing and you want to put that on the balance sheet, and you want to keep things off the P&L to help your, to make your net look better. Well, this is not your friend, right? But it also means that your debt could be lower, which could be your friend. Again, it depends on what the investors or the financial aspects of the business are. So I'm just curious, has that changed at all, or are we just is IT having to kind of to help the business people understand why there's more stuff on the P&L now?
Yeah, I'd say they are, because I'm trying to think back, to my days when it was heavier capex to opex, and as things started to move to hit that P&L. The challenge we were facing was, what are you going to give up? Like, what are you willing to sacrifice? You want me to spend, $800,000 a year? I need you to offset this by 400,000 or 300,000, whatever it may be. And so those are the conversations we're having now: is how are you going to offset the cost? It could be headcount, it could be retiring a software, and you go looking for something that you can get the additional capabilities in now by buying from one technology vendor, but you still can replace like 2 other solutions because you get it in this one now. So it's a different mindset to go into when you think about making an investment now. So it's like, okay, let me look at the inventory of what we have. All right, so what does this technology provider give us? Well, they do this, this, and this. Okay, so let's talk about updating our plan, our RFI, RFP to include that in there. So I have a good story to go say, well, I know you're going to spend an extra $240,000 a year by going with this solution. I'm also going to take it off the back end with these 2 solutions going away.
Right.
So it is transitioning more, but like, cloud-based services, email, Office, even G Suite, that was something you used to have on-prem. and you bought the license and paid an annual maintenance on it, and now they're flipping that over. And so, yeah, the CFO is more aware, more challenging when it comes to requesting those type of investments, and they're less CapEx focused.
Yeah, and I mean there's no doubt that, I mean, I'm not saying it was a good thing, but depending on where you were as a business, right? You could run things, you could let things get old, right? You could let things go past, I won't say past useful life, but certainly out of quote unquote compliance. You wouldn't necessarily have to be on the latest version, right? And with cloud services, baby, you're on the latest version, right? I guess that's the upside, but the downside is the charge is every month if you want to keep being able to have that particular service, right? Whereas before you had some flexibility to, depending on how you wanted to time the expenditure of renewing or buying a new version, that kind of thing. And that's, I mean, it's more complex in some ways. This is a simpler system, but to your point, it's been a good time to sell subscription services because it's a very predictable revenue stream, right? Particularly if you're talking about core services that are difficult to do without, the things like core collaboration platforms or things like that. Whoever your EHR provider is at a hospital, yes, there are different ones to go with, but whichever one you have, you got to have it, right? I mean, you can't run the hospital without it. It doesn't work. So,
yeah. And, you hit on a point that I think about from time to time is on-prem versus in a cloud. Yeah, the cost might be a little bit more expensive at the bottom line, but at the same time, you got to think about, you don't have assets that you have to recycle every so often, meaning hardware or virtual platforms. And then you don't have the maintenance cost of patching. So there's soft dollars that go into resources that do all that. You don't have to impact operations with upgrades. So there's a lot of pieces that you should be able to take and capture that cost or what the impact is on the business when you're having those discussions around subscription-based pricing.
Yeah, and I guess, sort of maybe tangential to it, but not, I don't think it is. An economist would certainly say it's not, and that's the opportunity cost associated with running, to your point. So take a traditional data center model or on-prem delivery of software versus cloud-based, right? That means you got to have people who are good at doing those things, right? And then have to spend time care and feeding them, right? And it's not the application itself, it's the underlying delivery of it, right? It's like, it's not just having utilities, you also have to take care of the lines and the power generation, right? So there's an opportunity cost of your people associated with that if you're a healthcare company, I mean, most healthcare companies are not in the business of, their goal is not to be great at data center, right? It's to be great at patient care or whatever it is. And so there's inevitably, distractions, maybe not the right word, but it's an opportunity cost because your people are doing that. They can't do something else. It's just that simple. And that's, there's no way around that. Life is full of those things, but the goal is to try to line them up as best you can in your favor or to support what it is you're trying to be good at so that, you can get customers. All right, last question. We've talked a lot about it from the IT perspective. People listen to this podcast who are not all IT people. They're people that are business people who deal with IT. What are some questions that business people should be asking of their IT folks around this issue of investments? What is it that they should be asking that maybe they are not or have thought about, but maybe didn't know how to frame it?
Oh, that's a great question. Because every time I think I have all the answers to that conversation, I always get hit with one out of left field. There's a lot of times I've heard, so what if we don't make this investment? What's it impact? You just don't get to mature something in your organization. Like, tell me what impact it has on the business by not making this investment. I get that quite a bit from people that just are, CFOs or finance people that are like, I don't want to spend the money.
Right.
Or can you wait till June? That's another one I get. Can you wait till June? Can you wait till September? How far out can you wait before we make the investment?
Do you think those are good questions? I mean, they're not, I know where they're coming from. They're not necessarily coming from the IT perspective, but they seem fair in the broader context, right? I mean, even if the answer is no, hell no, we can't wait. I mean, that might be the answer.
Yeah. And the CFO and the finance people are going to know where the company is, for meeting their targets, right? And so if you can wait just a little bit, you're helping manage their targets a lot better, because you miss those targets time and time again. If you're public, stock price drops.
Right.
If you're not public, people go.
Yep.
And so that's part of the reason they're asking those questions. I've seen people challenge the business justifications for it as well. For example, that IAM solution. I've already made 2 investments and it failed both times. So what are you going to do that's different than the previous 2?
Yeah, now that's a fair question. I would argue that's a good question to ask, and I would imagine you guys walked in the door prepared for that one.
Oh yeah, we had a stack, we had a plan, we had timelines.
Yeah, if you weren't ready for that one, shame on you, right? Then that
Yeah, and so I've even been challenged with, what are you going to tell that doctor when I can't buy the system he needs to perform that new service line we're getting ready to implement? I'm like, oof, that hurts.
Trade-offs are a bitch.
Exactly. Are you going to have a service line if I don't implement this new cyber?
Yeah, I mean, that's unfortunately, that's kind of, all of us deal with that, right? The trade-offs and they're hard. They're not fun. Somebody gets their feelings hurt or doesn't get what they want,
Yeah, but in preparation for a lot of those, I always try to think about the personality that I'm dealing with, the questions I've seen them ask of others or of me, and I try to be prepared to walk in there. But I tell them, every time you walk in there, there's always something, because they see a different side of the business that you don't see, and they know what's going on. And so, yeah, it hurts sometimes, but they'll cut to the chase and tell you no, right?
Yeah.
So
I get it. All right. Well, before we wrap up, as you remember, I like to ask kind of a question, just to sort of, I call it personal questions, not 100% personal, but it is a little bit. And I asked you this a while ago, but it was 3 or 4. It's hard to believe I think it's been 4 months now since we talked last, which it doesn't feel like it was that long ago, but here you are. So, based on what you told me you've been up to lately, I get it, for sure. I wouldn't trade places with you given what you've had to deal with lately. But hopefully you're closing on the end. So that's good. I'm going to re-ask you this question. And that's, can you share something that you've watched or read lately that you think others ought to check out?
Well, I'll tell you after tonight.
It doesn't sound like you've watched anything or read anything in the last 2 or 3 weeks, but outside of that,
I haven't really. Yeah. No, but John Wick 4 comes out tonight. So
are you going?
I haven't even had a chance to get tickets, but I'm hoping that I can jump online and catch like a late show somewhere. But I want to. But then I thought about it. I was like, I can't take my 11-year-old to that. My wife's like, so I'm going to call a buddy.
You can't really take it's not really 11-year-old. I mean,
that's not
yet. Not yet. Yeah. All right. Well, Scott, we'll wrap right there. Let you get back to it. I know you're still knee deep. Hopefully you get enough time to go see John Wick 4 tonight, though. Thanks again for coming back to cut the shit for a part 2. It was a real pleasure, and we'll talk to you soon. Okay.
All right. Thank you for having me again, Bryan.
All right. Thanks, Scott. See you. We hope you enjoyed this episode. If you are enjoying the podcast, we'd appreciate it if you would become a subscriber wherever you get your podcasts. And if you could rate and review the show on Apple Podcasts and Spotify, that would really help us out. Or you can just go old school and tell your friends, your family, your colleagues, and hell, anybody else who you think might want to hear something like this to listen in. If you're on social media, make sure to follow us on TikTok at CutTheShitPod, all one word, where we post lots of clips from the podcast. And last but not least, you can also watch the YouTube version of the show on our YouTube channel at Plow Networks. Until next time, take care and have a great day.